Hi everyone, I'm Dr. Ramya G. Gowda, Senior Fertility Consultant at Cloudnine Group of Hospitals, Bangalore and Sarjapur Road, Bangalore. We term a couple as unexplained infertility when the basic parameters like ovulation, the semen analysis, the fallopian tube status and the hormonal status, if everything is normal in spite of that and in spite of spending good amount of intimate time, that means very frequent sexual intercourse like 3 to 4 times a week, in spite of all these things, if the pregnancy is not happening in a couple, we call it as unexplained infertility, which constitutes around 10 to 15% of the total infertile population. So in such cases, if the age of the woman is young, like less than 35, and if her periods are regular and if they are able to have a normal intercourse, the basic and the simple treatment like even the ovulation induction and the timed intercourse can help them. So how do we do that? We monitor the ovulation through serial ultrasound, where we do the first ultrasound during the periods and we repeat the same ultrasound after 10 days to identify the date of ovulation, and we tell them which is their peak fertile time and we ask them to have an intercourse at that time. If they have a natural intercourse, the semen is viable inside the body for up to 3 to 5 days, and sometimes if that is not working, we also do something called intrauterine insemination, where at the time of ovulation, apart from couple having a natural intercourse, we also ask the gentleman to give the semen sample, we wash it and we place it inside the uterus. So that also increases the pregnancy chance in unexplained infertility. If the age of the couple is less, then we can try as many cycles as up to 6 cycles of these inseminations and timed intercourse, and if that also doesn't work, then we can go for the next step called IVF.